As Minister for Active Aging, what are your main responsibilities?
So this ministry, it's a fairly new ministry in Malta. It's been active since 3-4 years. I've been minister for the past 1.5 years. The ministry is a very interesting ministry because it is a mix of social care, but there's a lot of health in it as well. In brief, the ministry is responsible for initiatives for the well-being of all older persons in the community, older persons that require care in long-term facilities. On top of that, we are very mindful that with all the social and health aspects that the ministry entails, we have to be mindful of the environment. We have to be careful and mindful about technology and digitalization. So, in a way, as I said, it's interesting, it's very sensitive, because a lot of what we do is related to persons who are vulnerable, who are dependent. So with the ministry comes a lot of responsibility. And we are very careful about that. We're careful about the standards of care we offer. And topmost in our priorities is that we are obliged actually to look at persons holistically. So one of our ethoses is that we have to look at the care we deliver from a person-centered perspective. On top of that, I'm also responsible for the regulation of medicines and medical devices in Malta. So that is a big chunk of my work as well. In brief, that is my portfolio.
And what does a typical working day look like for you?
Well, my typical working day is that it's not typical. So, in that, as you see, this is my office, and to tell you the truth, it's a great office. As you can see, the views from our terrace here are unparalleled. So I must say it's a pleasure to work in this office. Over here we hold meetings with practically every stakeholder in the business, as it were. So my mornings are usually involved with meeting my staff, and we hold regular meetings about our various strategies. We meet various non-governmental organizations that deal with older person care and interests. We have very regular meetings on medicines, for example. As you know, the medicinal shortage after the COVID pandemic has hit most countries. Malta is, of course, not immune. In a way, compared to other European countries, we are, I'm not going to say at the mercy, but we are at the receiving end of all the repercussions that happen around us. And sadly, it's an industry where Malta cannot trade and influence, as it were, because Malta is a small country that does not produce medicines. So in a way, we are very lucky that we're small. So a small country is more easily perhaps supplied with medications. But as I said, we're not immune to the wider picture. So yes, talking about medicine shortages and how to address those issues takes a lot of my time, and rightfully so. I must admit that it is very important for me to speak to the stakeholders, to speak to all involved, because as a minister I try to do my best not to interfere in the various operations. But as a minister, it is my responsibility to shape these two disparate sectors, older person care and medicinal care. They're quite disparate. In a way, they intersect at several points. But my job is, as I said, to shape the overall strategy rather than going into the nitty-gritty. By profession, I'm a doctor, I'm a surgeon, so it will be easy for me to try and go into the detail. But I think that will diminish from my overall responsibility to transmit, to convey the vision and the strategy of government. In the afternoon, first of all, I hate having lunch, for example. If I have lunch, it will usually be a big lunch, and then that will make me sleepy. So I try to avoid as much as possible to have lunch. In the afternoon, I usually meet with our colleagues from downstairs who form the civil section of the ministry. As it were, they implement the strategies that are discussed at ministerial and at cabinet level. Of course, the civil part of the ministry has to be on board with our vision, and I must admit that we work extremely well together. And then there's Parliament. In Malta, ministers are elected, and we are members of Parliament as well. And I will attend Parliament, which is up the road here in Valletta. And following Parliament, then it's time to go home, really. So this is, a fairly typical day. As I said, I'm a trained surgeon, and I have some experience with dealing with complex conditions which usually affect older persons. And the Cabinet of Ministers has agreed that I should still offer that part of my expertise in the National Health Service. And I do that once every week, sometimes once every fortnight. And I'm involved with cases that are fairly complex, as I said, where my expertise in this small country has been considered essential. So I'm grateful for my colleagues in Cabinet for their approval of this arrangement.
And what role can technology play to help elders with active aging?
If we have a deficit in human resources, I believe that the only feasible solution is to use technology. To use technology to augment the human resource, but to use it intelligently. We speak about digitalization all the time. It's a sexy word, it's the modern way of addressing many issues. When technology comes to be applied to care, we need to be very careful here. We're all for technology. However, we need to ensure that the technology we're going to use is technology with the person in focus. We cannot adopt any form of technology because the minister wants it, or because a company who has developed the software, for example, wants it. Every technology that is worth its salt has to be produced and developed with the person in mind, with the person in mind. We are also mindful that when we are adopting technology and digital devices and what have you, there is a digital divide. There are members of staff who are very savvy in technology and software and apps and what have you. There are other staff that aren't. So the ministry has to be sure that there is a level playing field, that we educate our staff as is required. It doesn't stop there. If we're going to offer person and patient-centered care, you need to make sure that the population you're dealing with, the population that you're caring for, is equally savvy. You cannot have two sections of older persons, the older person that is conversant with technology and the one that isn't. It is our duty to make sure that there is no digital divide. And again, that comes from efforts and strides in educating the population. And that is, very focal, very important for our ministry to transmit this message. We don't want any inequality in the level of knowledge of our staff, and most importantly, the level of knowledge of the people we look after. That would be a disaster, because it would cause a sort of an elitist part of our population that is doing well with technology and so on and so forth, and the part that is always at the receiving end. Here what comes to mind, and this is very topical for older persons, are banking services. Banking services is very good to switch to digital. I'm in favor of that. Less paperwork, less this, less that. But, is every older person who needs to use a bank conversant with, online banking? Are we doing our best to make sure that there is no divide? So, in my opinion, that's a very important task that we cannot oversee.